PDL1 expression really is an established biomarker in recurrent metastatic head and neck cancer. We talked a little bit about the fact that in nasopharynx cancer, it may not be a very strong biomarker as much as we see in non-nasopharynx cancer. There are, from the early trials that we saw in non-nasopharynx cancer, it seemed combination of PDL1 as well as tumor mutation burden may be a winning strategy in terms of predicting outcome, but those are relatively older studies. And I think we really need to look in more modern eyes, if you like, on what are the predictive biomarkers, and what's the big focus now, I think, is the spatial distribution of the immune-related cells in the tumor microenvironment, specifically data coming out on the value of B-cell infiltration as a predictive biomarker in some of these tumors. So tumor infiltration by itself is not necessarily a predictive outcome. And as you know, head and neck cancer in general is a very tumor-infiltrated cancer. But it's really the type of infiltration, and it's really what cells are infiltrating the tumor and where are these cells. Studies from our group and others have clearly shown that these B-cell specific these B-cell antigen-specific cells are basically in the tumor peritumoral niche, in other words, in the stroma and the tumor lymph nodes, at least in HPV-positive disease. And so more work needs to be done along those lines to basically delineate what infiltration patterns actually is predictive of outcome. It seems that B-cell infiltration and HPV-positive disease, both of these factors predict for improved outcome, at least in some data that we saw retrospectively from TCGA.